Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Register before June 20th and receive 15% off seating. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio on this absolutely beautiful respite from all the thunderstorms and boomers we've had all week long, so get outside and enjoy it after you listen to Dr. Tom Roselle Live. In the meantime, waiting for your phone calls at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, and come up with, the things that you always come up with. It doesn't work, and there's no permanent relief whatsoever. So this is your opportunity. This is the place you can call. This is where you get your answers without drugs, without surgery. 888-630-WMAL. We're going to talk about a fascinating and very debilitating and very cost-prohibitive condition today, something that many of you, most of you, matter of fact, 80% of you will suffer from at some point of your life. 80% of you will suffer from low back pain. That's right, 80% of you. If you have low back pain, you're not alone. As just look around and line 10 people up, and 8 of you are going to experience it at one point or another. You know what? You spend $50 billion with a B dollars every year on low back pain, and that's straight up allopathic costs. That has nothing to do with the other ways that you're seeking to try to get it done. But the most common cause of low back pain is something that seems to miss the effect, and we're going to talk a little bit about that. But more importantly, this is the topic of our in-house continuing education program this Wednesday evening at the Roselle Center for Healing. It will be at 7:30 p.m. on Wednesday, June the 29th. And if you'd like to attend that class and find out more about what you can do to solve your problems, prevent your problems, this is your opportunity. Give our office a call at 703-698-7117. That's 703-698-7117. And tell my staff that you'd like to attend our in-house continuing education program on low back pain. I promise you we're going to get you out of the mess that you're in. Whether it's chronic problems or something that's acute, something that just happens, the most frequent occurrences of low back pain, often will actually go away pretty quickly within days, meaning 4, 5, 6, 7 days a week. And, they don't seem to come back, at least apparently, except for a few months later or maybe a year later. And then over time, they come back even more often than that. Other conditions, when you get them, and they seem to hang on, and they just never go away, and you learn how to put up with them, and it is a very debilitating thing, because what it does, it changes your life. It doesn't allow you to do the things that you normally do. The pain comes from your back, and then it goes down your legs, and it involves your feet, and you try to lift something up, or you try to lift your children up or your grandchildren, and you can't lift anymore. Just a 5 or 10 pound weight in the wrong place seems to break you down, and that's not a good thing. So we're going to talk a little bit about the structures of back pain today. We're going to talk about the causes. We're going to see if we can put a little bit of fix-it in there for you, and we're going to talk about degenerative and bulging slip discs. They're all different because they're different structures, but we want to talk about the most important things. And we're here at 888-630-9625. We're going to talk about some of your problems as well, and hopefully we can shed a light on a lot of things for you. Low back pain is something that chiropractors actually are the go-to guys for. If you go to the National Institute of Neurological Disorders and Stroke, they've done tremendous amount of research over the years, and you go to journals like the Journal of Manual Manipulation and Physiological Therapeutics, they will tell you something very similar across the information piece. What they're going to tell you is that the most effective means of treatment and the most cost-effective means of treatment is chiropractic care. And since I'm a chiropractor and an acupuncturist nutritionist, I know a little bit about that. So we're going to talk about those things from a very different point of view today. And if you go on, there are different organizations that are out there. But the bottom line is drugs and surgery when it comes to low back pain should be avoided at all costs simply because of the long-term effect. Let me tell you something about surgery. I have patients, obviously, that have come in post-surgically and patients that were contemplating surgery. Here's the deal with surgery. The effectiveness of surgery in any type of low back problem, slip disc, degenerative disc, stenosis, is 50%. That means that your doctor says you need surgery and you go in and you have a 50% chance of it being successful. What does that mean, successful? Successful means that your condition doesn't progress. Doesn't mean you're better. It means it doesn't get worse. And in a lot of the cases, obviously, it turns around and becomes much better. You know, the pain goes away. It's not in your leg anymore, but they tell you that, you know, you should be a whole lot better, but in many cases you don't. And then in 50% of those cases, half of you, after you go into low back surgery, you get worse. You get worse. The pain progresses for a lot of reasons. One, it was the wrong application. They didn't understand the mechanism. They didn't understand the mechanics of this. Traditionally, we look at things in the allopathic community as an area, your low back. But when you really understand the process, when you understand where it comes from, then you have a better chance of resolving the condition and making things a whole lot worse. National Institute of Health has been doing all kinds of trials, and they've been doing it not only in this country but out the world, also in cooperation, as I said, with the National Institute of Neurological Disease and Stroke. The cooperative trials that they've been doing show straight up that surgery and drugs need to be avoided. You know, one of the most common drugs for low back pain is what? It's a non-steroidal anti-inflammatory. And most of these guys act as what we call a COX inhibitor. That means that they try to stop the pain threshold from coming about, but it doesn't do anything to serve it. But the problem is that the side effect is simply this. One of the side effects is it actually makes the problem worse over time. It causes it to continue to break down and become much more serious than it need be. When some of these conditions are extremely easy to treat, they're pretty straight up, but we're going to talk about that, and we're going to talk about how this goes together for you and to resolve your problems. In-house continuing education program this Wednesday evening, June the 29th at the Roselle Center for Healing, 7:30 p.m. We're going to do a whole night on low back pain. We're going to talk about exercises you can do. We're going to talk about things that you can make a difference in your life and the most effective ways of treatment. I would encourage you, if you're suffering with low back pain, don't miss this night. It's something that will help you. It will benefit you. And one of my senior colleagues, Dr. Leonard Poe, is going to be your presenter. He is taking a class this weekend. Yeah, he's actually out there doing a little continuing education study. You know, have to do it. We all have to get smarter. Well, he's already a smart guy, and he's going to be there for you. Give our office a call at 703-698-7117. We're going to talk about low back pain today. But before we do that, let's go to the phones. Bill, thank you for calling. How can I help you, sir?
Hi, Dr. Roselle. I only wish you were on 3 hours on Sunday instead of 1 hour.
Me too. You know, if you have influence with the radio station, call them up and tell them that they have to give us 2 more hours. And
if I had influence with the radio station, Chris Core and Andy Parks would still be there.
And you and me both. But that's a different story.
Anyway, I'm sorry to be off topic, but I found out that cranberries are supposed to be high in antioxidants and good for you. But I was also warned that if you have gout, cranberries are bad for you.
Yes and no. It depends. Actually, the thing that you want to deal with gout is black cherry juice, black oxheart cherry juice.
Well, I already take the regular cherry juice, the tart cherry juice.
Yeah, go get yourself some black oxheart cherry juice at the health food stores. They've got them. They have them in bottles. And if you have a couple ounces of that every day, that will make a big difference. The other thing that you need to know is there's a homeopathic called Ledum, L-E-D-U-M, Ledum Polester, that works very, very well with gout. But here's the deal with gout. Gout is the formation of uric acid as a result of a failure in purity and metabolism within the liver. And the problem is it makes these really sharp crystals that get in and start tearing up joint spaces, and can be awful. I mean, they can get into the spine. It causes black and bluing of the joint spaces and swelling, and it's crippling. So, but I'm just going to list the things that are going to make it worse. Anytime, if you're eating, and I'm using you as the global you, all of us that are listening, right? Red meats and alcohol and refined foods and things that have a lot of additives and preservatives, things that are exposures to the things that are runoffs from the farms in Maryland that get into our water system. All these things cause the liver to be toxic. And when the liver is toxic, then we have all kinds of pathway problems, and this is one of them. But traditionally, what you have to do is you have to go to fish or chicken or turkey, organic. You want to get a ton of organic vegetables, lots and lots of water with lemon juice in it. And that's the beginning stages. You begin to clear the stuff out. You want to go as alkaline as you possibly can. And when that happens, your body's metabolism begins to work. Now, over a period of time, you can heal this in any other condition. When I was in college, in my stupid days, so to speak, and I was playing football, I never drank during season. I was a D1 athlete out at Kent State University in Ohio. But off season, like every dumb kid in the world, I drank beer and ate pizza, and before I got smart and became who I am today. But what I ended up with as a young guy was gout, and
gout as a young guy?
Young as a guy. Trust me, you have no idea. Those were bad days. But I learned early on, it wasn't severe. My uric acid creeped up just a little bit, and I noticed that I was getting some soreness at injury areas, from practice. So once I found out, what it was, I went to a really smart guy. He was an alternative medicine guy, but I didn't know anything about what I do in those days. And he said, listen, eliminate these things, go eat a bunch of cherries, and you'll feel better. And I did, and I cleared it up. And then years later, obviously, when I went to school, I found out, listen, you can prevent this stuff, and it can heal it, and you can reverse it. And in 40 years, I've never had another problem. So you can fix it. So that's the only reason I'm relating the story. I don't want to tell you how bad I was because, we all had our ineloquent moments.
I'll talk to you Wednesday night.
Okay. I'll be there with Dr. Poe.
Anything else I should be taking besides the black cherry juice?
No, if you do that and you go to the health food store and get Ledum Polester, that's the beginning stages. Without knowing your metabolic pathways, it's difficult to tell. But if you do that, you get some B complex, some high levels of vitamin C, you'll begin to churn. If you have high levels of inflammation, anything that is an antioxidant will bring it down. B12, folic acid. The hydroxy form of B12 is the best used. There's a company by the name of Perk Laboratories that is difficult to get. I don't think they sell to health food stores. Most professionals that do alternative medicine or functional medicine or integrative care like we do can get it. There are some labs, but what you want to remember is that it's a hydroxy form of B12 that is the guy that does the anti-inflammatory work. So check that out. But Bill, I'm more than happy to talk to you anytime. Thank you for the call. I appreciate it.
Thank you, Doctor.
888-630-WMAL. That's 888-630-9625. We're talking about low back pain and the incidence. And 1 out of 4 of you in, the immediate area are suffering from low back pain now. And the unfortunate part is that 80% of all of you will have low back pain at some time of your life. We're going to talk about that specifically. When we come back, we're going to start talking about the causes of low back pain. We're going to get back to the phones and answer your questions. This is Dr. Tom Roselle. Don't go away because I got some really important things to share with you today that I think that you can utilize and make your health a whole lot better than what it is. We'll be right back.
This is Dr. Tom Roselle live on 630 WMAL. Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Want to remind you, ongoing sponsor of Dr. Tom Roselle Live is Thermography Centers of Fairfax. If you haven't begun to incorporate thermographic imaging as part of your annual health, physical, and evaluation, you're being very foolish, because thermographic imaging detects the heat levels of an inflammatory process in your body. It shows things up as the beginning stages, as they're beginning to really get a hold of you, when you can do something about them. You know, even ladies, if you get your mammography, whatever, if you don't do thermography first, you're missing a whole lot of things, because what it does is it picks up the signal of the beginning stages of blood formation, the vascular bed that ultimately will grow the tumor. And if you see that and it begins to progress, you can do something before it's diagnosable as cancer. Call Dareth Painter at 703-943-7248. That's 703-943-7248. I had a patient that was complaining of a toothache, and she went to the dentist, and they took x-rays, and they couldn't find anything. And we did a thermographic scan, referred her over for an evaluation, and it came back as a really hot heat signal over this one area. And what it wasn't the tooth, it was the nerve that comes from the temporomandibular joint, the jaw. It was going to the tooth. It was hot. There was pressure on the nerve. And so subsequently what was happening is the patient was clenching at nighttime, and for whatever reason nobody was picking it up, but we got her fitted for a nighttime orthotic and was able to treat her and adjust her and so forth, and the pain went away. Thermographic imaging is amazing. Call Dareth Painter at 703-943-7248 and make it part of your annual evaluation. What causes low back pain? Well, age does a little bit, and bone strength and muscle elasticity and so forth. You can have low back pain and spinal pain and hip pain and pelvis pain for a lot of reasons. When you say age really doesn't matter here. It's a time that pursues over the length of our lives, right? It's about neglect. It's about being out of shape. It's about the vertebrae, the bones of your spine, moving out of position and then locking out of position and pinching nerves or overstretching nerves or causing the neurological bed to be irritated. And now you've got pain. And you also have loss of function, by the way. I want you to remember something. You know, the nerves that go to your legs and your back and so forth also go to the organ systems of the colon and the genital system and so forth. And a lot of guys we see that come in with low back pain also have problems with impotency, erectile dysfunction, because that nerve goes there. And if that nerve is being pinched, it's like turning the lights off, guys. Nothing's working. So don't ignore mild low back pain, because it's going to affect a lot of other things. But the disc spaces, these shock absorbers in between the bones of your spine, the vertebrae, they begin to lose their fluid because of their disrelationship, meaning the bones are out of place. They put pressure on the disc space, and they cause pushing. The stuff that slips, you know, when you hear about a slipped disc, that's really like toothpaste, and that's the consistency of it in the center of this disc. And it begins to break through the fibers, and pretty soon it puts a bulge in it, like a big old jelly donut or an ice cream sandwich that's kind of oozing over the edge, and it puts pressure on the cord. Now, that's one of the pieces. You can have overstretched ligaments. You have muscles that aren't firing in a reciprocating fashion, meaning you have one muscle that's pulling tight, the other one should balance it out, and sometimes one muscle weakens in opposition to the other. So you have to understand that there's mechanical reasons that these things have. These disc spaces, these misalignments that we call subluxation, can put pressure on many of the nerve roots that come from the spine and go to the different areas. By the way, when our caller talked about gout can cause low back pain simply because of its affinity for the joints of the body, not just the extremities and the knees and the ankles and the fingers and so forth, but can go to the spine. And we have something called gouty arthritis as a result of it. We have osteoporosis or osteopenia, which is a loss of the calcium from the bones because of the lifestyles that many of you lead, you know, not eating the things that you should be eating. I was at a class yesterday, and it was a class on nutritional. I had to get some CE credits as well. And they were talking about some of the mechanisms, the dietary pathways and so forth that lead to the loss of substance within the bone, and so many of us doing the Great American Diet are causing these things to happen. And when we get hurt, and sometimes we have built up a scar tissue in there, people who have blood sugar imbalances, potentially diabetic conditions, ultimately have problems. If you have your fight-flight system, your adrenal glands aren't working, you're not putting out steroids, things that are called mineralocorticoids. These are things that allow for ligaments and tendons to stay strong, and when that's not working, all you got to do is twist the wrong way and you got trouble. This Wednesday evening, Dr. Leonard Poe will be your host, talking about low back pain, the fix behind low back pain at the Roselle Center for Healing. Call our office at 703-698-7117. Stay tuned. We have to break for news and a few very important messages. Don't go away.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back on this beautiful Sunday afternoon. Get out and enjoy it after you're done listening to Dr. Tom Roselle Live, because I'm going to go play this afternoon. I have an airplane waiting with my name on it. I'm going to go fly the Blue Ridge. I'm going to have some fun today. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about low back pain. This Wednesday evening, Dr. Leonard Poe will be your host at our office for our ongoing in-house continuing education program. We're going to be dealing with low back problems and what you can do to protect it, what you can do to treat it, what you can do to make a big difference for the first time and let it go away. Because the truth of it is that 1 out of 4 of you have a problem now, and 80% of our entire population will have some sort of ongoing chronic low back pain or an acute episode at some point of their life. This is monumental. We're talking about a minimum of $50 billion a year problem, and it doesn't go away. You know, some of you take aspirin or a nonsteroidal anti-inflammatory on a day-to-day basis, and the problem with that is that when you take this stuff, it makes life worse for you, because aspirin causes degeneration of the disc space. It knocks out the inflammatory reaction, but it causes further breakdown and degeneration. Now, I don't think that's something that you want to do, but that's the truth. Aspirin will cause more problems. If you go to Medscape, it's a website, Medscape, S-C-A-P-E. There's a lot of good education in there for you. And you look up NSAIDs and manipulation ineffective for acute low back pain, a best evidence review. What they do is they talk about the problem with NSAIDs, and the lifetime prevalence they talk about in this is somewhere between 60 to 85%. Most of the literature says it's 80%. And it's a problem that is made worse by so much of what we do with our lives. People that are using nonsteroidal anti-inflammatories, aspirin, if you will, or any of the other aspirin types of things, show that the side effect is that over time the problem becomes worse, and that it also causes problems with kidney function and also causes problems with intestinal tract bleeding, obviously, because aspirin causes bleeding, and all the ramifications because of that, and anemia and the likes. Huge risk with this stuff. And the one nasty side effect of all NSAIDs, nonsteroidal anti-inflammatories used over time, and this includes that 81 milligram aspirin, if you look it up, in susceptible people will cause heart failure. And this is no poppycock, as they say. This is real stuff. A lot of references for this, and just go to that one site and they'll tell you all kinds of things that you may not want to know, but I think that you need to know, because low back pain can cause a problem. We're talking about what conditions are associated with it. You know, when we're dealing with low back pain, things like loss of calcium, osteoporosis, are going to be there. We're going to talk about bulging discs. There are also protruded discs and herniated and ruptured discs. We're talking about stenosis. That's a narrowing of the hole, the canal where the nerve comes out of, and that can happen because of injury, can be because of diet, because of postural positions and so forth over time. The skeletal irregularities in people, they're a whole bunch of differences in how we're put together, and if we don't maximize our lifestyles relative to those things and get some exercise, lack of exercise, period. I mean, a lot of you are just couch potatoes. You know, you don't go anywhere, you don't do anything, you don't get any exercise, you've got way too much weight on you, and all of that has an effect on the spinal system. You've got to make a difference in your life to change anything. And these are one of the things that if you got good care, if you got good treatment, chiropractic care, manipulative care, even acupuncture and nutrition, you can turn around the huge majority of low back problems permanently and change things. And if you heard me talk, you know that I say the body's extremely forgiving and it will fix almost anything. Well, get off your tush. You got to fix this stuff. And we're going to show you how to do that this Wednesday evening. I'd love to have you in the office. Love to show it to you. This is something that is so fixable. But most of us don't want to do anything about it. How do we, we're going to talk about diagnosis and how we diagnose these things. And it's really understanding the mechanics of the body. You have spinal vertebrae. You have 7 bones in your neck. You have 12 in your mid-back. The ribs come over. You have 5 in your low back. Then you have your hips. Those are called the ilium. You have this wedge-shaped bone in between. It's called the sacrum. And now they're all tied together with ligaments and tendons and muscles and fascia. Fascia is like plastic wrap that kind of works its way around every structure of your body. And when this stuff gets all tended up because you've either hurt it or you haven't paid attention to it or you got too much strain on it or you're not eating the things that you're supposed to be eating and your body's starting to break down even more and your inflammatory levels are going through the ceiling, you're going to have a problem. Ladies, some of you have had C-sections when you've delivered children. When they cut through that muscle, if the muscle doesn't maintain its proper position and ability to fire, you're going to have pain. You have to have pain. That's just the way it is because now your stomach muscles won't support the back. So that integrity, that ability of the muscle to fire properly has to be reinstituted. And sometimes you just end up with back pain. So, I've never had a problem until I had a child. And once I've had my children, now I've got back pain all the time, and I just take this and that for it, and my doctor told me I had to live with it. And garbage. You can change anything. You just have to make a decision that you're willing to do that. So we take a look at it. You look at x-rays sometime, but you don't need all the sophistication of CAT scans and MRIs and so forth. Sometimes a very limited x-ray of your low back showing the position of the vertebrae in a postural pattern. I mean, you don't lay down to take these things because that's not how you live. You stand up and you have the x-rays taken that way, and you see what your gravitational pattern is. You look at the feet because your feet can cause your back to be a problem. You have to look at nutrition. If you're not getting the things that you're supposed to be getting, you're either going to not have the chemistry to repair yourself with or you're going to cause further degeneration. Tons of research is being done out there. National Institute of Musculoskeletal Disorders, even to the Department of Veterans Affairs. Oh, by the way, did you know, as of now, chiropractors are now going to be part of the permanent staff of all of the military healthcare facilities throughout the country. They're going to be linked into the MASH units overseas and so forth. Because you know why? Because this works better, faster, at lower cost than anything else. So why not make yourself available to those things and learn more about that? And you have that opportunity, as I said, this Wednesday evening. Let's go to the phones because she's been very patient. Alice, how can I help you?
Hi, Dr. Roselle. Thanks for taking my call. I have 2 quick questions. First one is about the water that people drink, and I've been reading a book, and it was talking about how these deposits, the minerals in the water, they deposit in your arteries, and they get clogged, and then they are like cement. The other thing is that the best thing is to drink distilled water, which I'm planning to buy a distiller at home because of the fact that they have distilled water in plastic bottles which contain BPA.
Don't.
So, and then the other one thing is about the back pain that you're talking about. Does this have to do also with your circulation, the blood circulation, that you're not getting enough blood in these areas where, the arteries or the veins in the back?
Yes, so let's talk about your water first because you're misinformed. Never use distilled water as something that you drink every day because distilled water has a negative charge to it, and it's an imbalanced atom. And so when it goes into your body, it's good for detoxification because it's going to start grabbing off some of the bad things in your system. It's going to dump it out. But ongoingly, if you drink distilled water every day, it's going to grab your calcium, it's going to grab your minerals, it's going to start taking that and deplete your body. So it was never meant for long term. And so we could spend the rest of the program on this, and I can't do that today, but it's, in my opinion, and I would never, ever tell my patients to do that because you're going to cause more problems. And the more calcium you're going to pull out, the more back pain you're going to have, the more depletion, the more osteoporosis, the more cardiac problems. Short term, it works really well, but as a dietary pattern of something that you're doing all the time, don't do it. You want to have good, clean water that is from a pH of 7 to alkaline, not extremely alkaline, but in the neighborhood of 7.4, 7.5, 7.6 because it helps buffer. The natural mineral waters are excellent. They're very, very low level. They don't have if you're putting things into the water, it's a different story. But the ones that are natural mineralization and they're at low level alkalinity, these are not bad things because your body needs these minerals. Now, anything that's artificial is a whole different conversation. But you're reading some things that I would take tremendous amount of exception to. So you want good, clear water. You want water that if you can't go buy bottled water all the time. What you do is you get a filter. You make sure your water filter is getting 99% of all the junk out. You want to make sure that the water stays as alkaline as possible, above a pH of 7. And that's where you go with it. Anything other than that long term is going to cause you some problems. And as I said, it can cause low back problems in addition to that.
So why don't they, the FDA tell them to bottle the water in glass bottles?
The FDA is nothing but a organization that is extremely manipulated. When you take a look at the board of directors of the FDA and you see where they come from. Most of these guys have significant interest in the drug companies. You got to remember something. The drug companies are not there to heal you. They're not there to kill you. They're there to keep you in this place where they can maintain you. Because if you're not taking their medications, they don't make any money, right? Yeah. So in the procedures for evaluation in the FDA today, they're letting drugs out there just with, you become the guinea pig. You become the, the place where they find 10 years later that the drugs that they put out there are killing people. Yeah. And, right now, the bisphosphonates, that they told women to take years ago, now we're seeing that we're losing teeth because of them. Our jaws are breaking down. We're increasing our fracture risk. We're increasing different types of cancers within the body. That stuff is garbage. It's not supposed to be. It kills the bone. It actually deadens the bone. So again, a different story, but one that we could. When I get Sue on here one of these days, she and I will go, for an hour, and we will talk about the bisphosphonates again, when we have in the past as well. But I hope that's helped you a little bit. But I would never take distilled water as part of my normal dietary pattern unless I was doing a detoxification, a cleansing process, and other than that, get good filtered water and get it in a glass bottle. You don't want it in plastic. When you heat plastic, you risk the levels of estrogens that it will leak from the plastic into the water. You get them. Subsequently, you increase your risk of cancers that are estrogen sensitive. So I hope, anyway, that helps a little bit, Alice.
Yeah, I buy the Italian still water in glass bottles from Whole Foods, so that's the only one I buy.
Okay, that's good. Get yourself a filter. It's cheaper.
Okay.
It's cheaper.
Thank you,
Thanks for calling. Bye-bye now. Number here is 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about low back pain, and we will be talking more about low back pain Wednesday evening, this Wednesday, June the 29th, in our office at 7:30 p.m. Dr. Leonard Poe will be your primary presenter. This is a night that if you had any back pain, if you have back pain, if you want to prevent back pain, show up. Call our office, 703-698-7117. Tell my staff that you'd like to attend. Another special event, and if I don't talk about this, many of you can get mad at me because Ageless Health 2011 is coming up September the 17th. And, unfortunately, the 15% reduction in price was over June the 20th. However, we are going to allow you to buy, if you buy 2 tickets, we will give them to you for $179. Price is $99 for one, so you get about 10% off for 2. go to our website at rosellecare.com. That's ROSELLECARE.com. And the VIP tickets, the VIP section is sold out. We don't have any more of them. We have some preferred seating, which is up front and close, and then we have general seating. So if you're going to do this event, if you're serious about changing your health and taking control of it and really making a difference, and you're committed to your wellness, really maximizing your capacity, you need to do this. You need to call. You need to get online. You can register online in a very secure site. You can call our office and register that way, 703-698-7117, or just go to our website at rosellecare.com, register right there, and you'll have your seat. I want to talk to you about something that I'm very happy of the turnout is. Many of you, I mean, this is not the venue for all of you, but, the television network that is for younger children, MTV, ages 15 to about 30, 35. Well, last week, Thursday night, they released a segment that many of you knew about and some of you didn't. I was treating a young girl with a very severe allergy reactions to the point that she would have anaphylaxis or she would go into seizure patterns. And it was compared to another young boy out of Texas who was being treated. Anyway, she'd been everywhere. She'd been to some of the top allergists in the country, and he was being treated medically. She was being treated by me. The end product of it was very, very well done. Obviously, the outcome was great. She's in a far better place today than she's ever been. The seizures are gone. She doesn't have any anaphylaxis, hasn't had them for about 3 months. We're still treating her. If you'd like to see that program, you can get it off our website. It's down on the right-hand side, about halfway down. It says, True Life, I'm Allergic to Everything, and it'll take you right to the 41-minute segment. Go watch it. I think you'll find it extremely interesting. I liked it because the outcome, she's much better child, and without drugs and without the intervention. But guess what? You can heal these things. We're going to take a break in a minute. You can get a hold of me at 888-630-9625. Remember, this Wednesday evening, the 29th, Dr. Leonard Poe, Low Back Pain, Roselle Center for Healing. We'll be right back. Don't go away.
This is Dr. Tom Roselle, live on 630 WMAL. Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've listened to Dr. Tom Roselle Live. We've been talking about low back pain and a few other things that have been of interest to you today. And this Wednesday evening, our in-house continuing education program will be brought to you by Dr. Leonard Poe, and we're going to be dealing with low back problems and the things that you can do to prevent it and what you can do to make sure that you don't get in trouble again after you fix it. Give our office a call at 703-698-7117. Tell my staff that you'd like to attend this Wednesday evening's presentation on low back pain. Please remember that we offer these as a public service to you, but we do have limited space, and we want to be supportive and we want to be respectful to you. And I hate to tell you that we don't have any room, so call us at 703-698-7117, and don't forget to register for Ageless Health 2011 Health is a Do-It-Yourself program, and we're going to offer you 2 tickets for $179, which is about 10% off. Give our office a call before we run out of those as well. VIP section's already gone, and the preferred seating is getting there, so call today or register online and get that done. Talking about low back pain, and we want you to realize that, most of you at some point of your life you're going to have low back pain, and how severe it is depends on your state of health and the things that you're doing to yourself. There are 24 separate bones of the spine, and the low back takes the burden of all of them at one point or the other. If you don't have the right mechanical distribution, you bend forward, the nerve gets trapped, it gets overstretched, it gets pinched, and it stays that way until something's done. And most of you end up taking all kinds of ridiculous medication to try to fix it, when the problem is that it gets worse. It doesn't fix anything. You can break these down in acute and subacute and chronic low back pain. And acute low back pain is something that lasts about 6 weeks, and that's no way to live. And subacute back pain can last up to 3 months, and chronic back pain is ongoing, and it can be something that comes and goes. And I have patients say, well, if I don't do this, it doesn't bother me. That's a heck of a way to live, my friends. Wouldn't you like to do what you need to do, and when you need to do it and make a difference? Well, we can show you how to do that. Come on this Wednesday evening and join us and see if we can get you squared away. If you have low back pain, or if you have a problem that's been there and you've been taking medications, you've been not doing the things that you want to do, you can't lift the way you want to lift, you can't play with your children, your grandchildren, not a good thing. What causes it? Standing, sitting, bending for extremely long periods of time in one position, lifting different things that are too heavy or in awkward positions, putting the wrong way. You fall, you trip, you slip, and, all of a sudden you have muscle spasm, and then, it's still there, but it's not like it used to be. Even stress and anxiety will cause low back problems. And many of you living in the Washington metropolitan area are like that all the time. You say, well, I'm like that all the time. Well, you can break the cycle. You can make things better. We talked about weight, posture patterns, and dietary patterns also. Gout is one of our callers early on, can go to the low back. But, whether it's a slip disc or stenosis or degenerative disease or, any of those things, they can all be fixed. So don't ignore it. Well, this Wednesday evening, Dr. Leonard Poe will present and tell you how. Call our office at 703-698-7117. I'm here every Sunday to answer any question that you have on any subject of your health and your wellness. 12 o'clock, WMAL. I'll see you next week. Bye.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.